Hello everyone, it is an honor to present my research. My name is Myoung-Hee. I'm a professor in the Department of Nursing at Konkuk University, and my colleague Myoung-Hee Kim, a professor in the Department of Nursing at Semyeong University. My research title is Factors Affecting the Sense of Community for Women in Community Participatory Health Service. Recent national health promotion projects emphasize community participation in order to promote health, improve quality of life, and elevate health inequality. The reason is that a community-based participatory approach can improve sustainable community health autonomy. According to several previous studies, it has been reported that community sense has a positive effect directly and indirectly on community participation and activities, and that cultivating a sense of community contributes to the health of people and a healthy environment for people living together in the community. The sense of community is formed through the mutual relationship between people and the environment, and this sense of community is an important factor that enables individuals to feel meaningful in the community and to increase their life satisfaction through belonging and stability. Human behavior can be said to be formed, changed, and maintained in the process of giving and receiving influences by interacting with the perception of individuals, constituting the local community and the multidimensional social, physical, and environmental factors to which they live and relate. Factors that determine the quality of life of local residents and the level of community health include not only health-related behaviors, including self-efficacy and the national healthcare system, but also other various factors are involved, such as local socio-physical environmental factors, education, and economical level of residents, and social network. Since the majority of participants in community resident participatory health projects are women, research on women as the main participants should be conducted. Therefore, this paper intends to prepare a plan to promote participation in the local community by identifying the factors that influence the sense of community of women living in the local community through the resident participatory health service conducted by the Public Health Center, which is a representative institution for providing public health care. Next, research methods. First, study design. This study is a secondary analysis study using a survey of health conditions and needs to strengthen the residents' capacity of C-City and G-구. Second, data collection method. The raw data was collected using a stratified complex sampling method based on a sampling frame created by linking resident registration, population data, and housing data, and all 237 adult women were analyzed. Third, research tool. 1. Sense of community. The sense of community is a tool developed by Peterson and Spear, Macmillan, and consists of 5 items of satisfaction and integration, 5 items of membership, 5 items of mutual influence, and 5 items of shared emotional intimacy. On a 5-point Likert scale, a higher score indicates a higher sense of community. In this study, the reliability was Cronbach alpha equal 0.91. Second, social network. The social network is a tool of Scandura and Regin and consists of a total of 6 items and a 5-point Likert scale. A higher score means a higher social network. In this study, the reliability was Cronbach alpha equal 0.89. Next research tool is social physical environment. The social physical environment was a tool used in the community health survey, and the reliability of this study was Cronbach alpha equal 0.80. Next, perceived self-efficacy. Perceived self-efficacy is a modified and supplemented tool of Scherer and Murdoch by Lee and consists of 4 items on goal performance, 4 items on problem-solving ability, and 2 items on self-confidence. On a 4-point Likert scale, higher score indicate higher self-efficacy. In this study, the reliability was Cronbach alpha equal 0.83. Next, data analysis method. The data were analyzed using SPSS version 24. General characteristics research variables were identified with descriptive statistics. In addition, testing for mean differences of sense of community in relation to general characteristics were analyzed using an independent t-test, the two-way ANOVA with the Scheffer-Posthock test. In order to identify the factors affecting the sense of community, a stepwise multiple regression analysis was used. Multiple logistic regression was used to identify the factor affecting participation in the participatory health service program. Next, research results and discussion. First, a sense of community according to general characteristics. As a result of analyzing the differences in the sense of community according to the general characteristics of the study subjects, significant differences were found in age, marital status, education level, and occupation. Table 1. Sense of community according to general characteristics of the participants. In the case of age, it was significantly higher from 40 to 64 years old and over 65 years old in comparison to under 40 years old. Marital status was significantly higher in married and other groups than in unmarried. In the case of education level, the group with less than elementary school and middle and high school grades was significantly higher than those with a college degree or higher. Those without jobs were statistically significantly higher than those with jobs. These results were consistent with the previous studies, where the older the subjects were and the more children they had, the higher their sense of community was. However, in a study of young people, the higher the income and education level, the higher the sense of community. On the other hand, in this study of all adult age groups, the sense of community was high when the education level was low and there was no job. Therefore, it is necessary to confirm it through repeated studies targeting various age groups in the future. Second, factor affecting the sense of community. As a result of performing stepwise multiple regression to identify the factors affecting the sense of community, the social network, the social-physical environment, and perceived self-efficacy were found to be variables that had a significant influence and had an explanatory power of 55%. Table 2. Factors affecting the sense of community. This result is consistent with previous studies that showed that community-resistant relationships such as belonging, attachment, solidarity, socio-economic characteristics, and physical characteristics influence the sense of community. Therefore, it is necessary to seek measures such as a promotion of social networks and the improvement of the socio-physical environment that affect the cultivation of a sense of community. Next, factors affecting participation in the community participatory health services. Multiple logistic regression was performed to identify the variables affecting the subject's participation in the community participatory health services. The final model was statistically significant and the explanatory power was 12.2%. As a result, the hypothesis that there is no difference between the observed and predict values of this model was not rejected, indicating that the final model was in good agreement with the data. As a result of classifying the group that participated in the community participatory health services of the public health center and the group that did not using this model, 70.3% were correctly classified overall. The variable affecting participation in the community participatory health services was the sense of community, and when the sense of community score increased by 1 point, the odds ratio to attend the community participatory health services was 3.29. This is Table 3, Predictors of Attendance of Community Participatory Health Services. This was similar to the previous study, which showed that the sense of community had a positive effect on various community participation and activities. For the efficient implementation of health promotion projects, when local community residents become the main actors and actively participate, not only health behaviors, but also the overall community, including the social environment, can be changed. In addition, this result is consistent with the previous studies. The social interaction is important in practicing health promotion behavior, and that it is strengthened when socially solidarity with friends or neighbors. Conclusion. As a result of this study, the sense of community was identified as a variable affecting participation in the community participatory health service of the public health center, and the social network, social physical environment, and self-efficacy were found to affect the sense of community. Based on these research results, it is necessary to prepare various opportunities for more local residents to participate in order to increase community participation in health promotion projects. In addition, it is necessary to activate official and informal community gathering and local events in the local community, and to establish self-help group, mentoring, and buddy system for people with the same interests among local residents. Through these activities, good relationships with neighbors are required. It is necessary to make efforts from various angles to raise the sense of community, such as strengthen social support by forming a social network. In addition, there is a need to expand the interest and participation of residents in the community by providing enough correct information on various factors that can affect health. At the same time, health education for the creation of a health environment and practice of healthy living will enhance the self-efficacy of residents and strengthen the capacity of the local community. This is references. Thank you for your attention.